record. Okay, it's recording. I'm gonna press play now. So we had emotional disabilities, and the emotional disability we chose was social anxiety disorder. So, social anxiety disorder is the fear of being judged and evaluated negatively by other people that may lead to feelings of inadequacy, inferiority, self-consciousness, embarrassment, humiliation, and depression. So, some common signs you might see in your students in the classroom is blushing, sweating, or trembling. So, they might be like moving their leg in their seat, or you might see like their palms like all sweaty, or they might be like sweating around their face. They might have a rapid heart rate. They might have rigid body posture or speaking with like an overly soft voice. So, they might be like super quiet and they're probably going to try to avoid going to school just because they don't want that social, like, anxiety, like, inducing situation. They might have emotional outbursts in different social situations. And they also might refuse to speak or participate in certain social situations. Here are some examples that you might see in the classroom. So there's like restlessness, like I said, like wanting to get up out of their chair or, just fidgeting in their seat. They might be like disruptive in the classroom because they're like moving around or just like really not wanting to participate. They may have trouble answering questions in class because that might be anxiety inducing for them. They might be unable to finish work as it takes them more time, or if it's like a group project, they might not want to do that. And also frequent nurse visits so they can like get out of class and not have to like tackle those social situations.
So, some accommodations that you can make for your students with social anxiety disorder is provide like a designated calm down area within the classroom environment, especially when it becomes overwhelming with many different kids. The like calm down area could be anywhere in the school or even just somewhere in the classroom where they can go back and relax for a few minutes. Incorporating scheduled and as needed breaks throughout the day allows them to calm down and become confident in what they're doing and not feel like they're being judged because they're not constantly being watched or turned on essentially in the classroom. Creating a plan to help the students make up work when they're absent. It can be very like stressful and anxiety inducing to be gone and then having to worry about coming back and remaking up all these assignments, especially when other students may like comment on why they may have been gone. So then they're worried as extra, basically. Allowing extra time to complete the tests and quizzes and projects and homework and etc. Like this allows them to not focus on everyone else because sometimes it can be distracting and you might focus on other people, especially if people are getting the quizzes and tests done quick, then they're just worried and becoming stressed and may not be doing the best they could be. So, not worrying about the time and allowing them to have that extra time allows them to focus and become more successful. Recording class lectures and assistance with note taking may be beneficial for the students. It'll allow them if they worried about their own note taking or are worried about other people judging them for the amount of notes or lack of notes, they can easily go back and look at the lectures or have like guided notes for them. Providing fidget and stress toys is also beneficial because it allows them to focus on something else and not focus on what everybody else is doing while they're doing their schoolwork. Some calm down strategies that the students may like is coloring or drawing can help them just be distracted. They can focus on the picture they're doing. Thinking positive thoughts will allow them to get out of the negative thoughts of the stress and what everybody else may be thinking. Taking deep breaths is important, and having like a meditation time or area will allow them to help calm down. Talking with someone, whether it's the teacher, another teacher, peers, or even like a counselor or nurse in the school will allow them to help calm down and take a break and stuff. Taking a break is also important. It allows them to just think about themselves or what they're doing instead of what everybody else is doing, taking the eyes off of them, basically. Reading is a good way to distract themselves. Walking or exercise is good to clear their head. Journaling about what they're thinking or what they think others may be thinking can allow them to get their thoughts out if they're not comfortable talking to others. And listening to music can also cause them to not be as distracted. Some challenges with social anxiety disorder would be severe social avoidance. They're not wanting to make many friends with others. Professional academic underachievement. This social anxiety may cause them to not be as successful in the classroom and cause them to just not be as academically invested as they could be. They could have difficulty forming relationships. The physical symptoms that they may put off in class, trembling, blushing, or panic attacks, which could cause some more social anxiety when others may see that. They will be constantly self-conscious of themselves and everything they're doing. And then there might be some significant negative self-talk about everything that they're doing and worrying. Some causes of social anxiety disorder would be genetic predispositions, the environmental influences, any traumatic events they may have experienced in their life, and cultural expectations.
So, some support services that students may need if they're experiencing this is group treatment. Another one is a school counselor or psychologist intervention. The school counselor can be a source while they're at school, while the psychologist can be a source for them outside of the school area. They could need individual or small group social skills help. So just help if they are doing things alone in the classroom or if they have to work with a group. They could get an IEP or 504 plan if the anxiety is significantly impacting their learning. They could go to outside therapy, which will help them learn skills to help handle their social anxiety. And then they could also go to any weekend social events. Some activities for informal assessments could be making your own quiz. You could do four corners, but without the corners. So this could be a hand signal pointing where you're feeling you want to go, or you could hold up colored paper for certain ways that you're feeling. You can do exit tickets to learn more. Journaling is super helpful, and then doing online question and answer tools to gain more information. Some interventions. The first one is CBT, which is cognitive behavioral theory, not theory, therapy. This helps with goal setting, any type of exposure, and then psychoeducation. The next is exposure therapy, which helps to reduce avoidance behaviors and then confront any social situations. Then we have some medications that people can go on. Some of those are SSRNs, nope, SSRIs or SNRIs. They're both an antidepressant that can boost serotonin to reduce any anxiety.
So here's our first accommodation video.
Oh, that would be great. Thank you.
So in that first video, you saw a student that was fidgeting while reading a book and they just like kept looking around. So the teacher came over and gave them like a little fidget toy. In this case, it was a Neato to help them like calm down and they can like squeeze that like while they're reading so they're not like stressed and like looking around at others. Here's our second accommodation video. Oh, what just happened?
Don't even worry about it. You still have more time to complete the test. Okay, thank you.
So in that second accommodation video, you saw a student that was taking a test and the timer went off for the whole class to stop testing, and the teacher came over to share with her that she had more time to complete the test and like to not worry and stress and that she would be able to complete it at a later date. And here are our resources for our PowerPoint. Thank you. And then here is our one-page handout that we would show to teachers and give them so they're able to understand what social anxiety disorder is and how they're able to like help their students that are in their classroom. So it kind of just gives a list of like the common signs that they may see in students, some accommodations that you can like have for them, how it affects their learning, and also support services that these students may need. And then our references for that are at the bottom too. So yeah, thank you.
Thank you.
Thank you.